should have a hypothesis why, no? Dapat maka-explain siya why mo ging assess ang amo na, no, is it relevant sa case ng patient or not. So those mga things like that. Okay, documentation is an excellent method of reflecting structured clinical decision making. Okay, so diri mo na di magamit imo nga skills on the application of your ICF. Okay. Documentation of patient can be used for quality assurance and improvement purposes. Okay, so there are actually may mga criteria na to set, no, to indicate quality of healthcare services is being actually rendered to the patient. Actually, mabalaan mo na through patient satisfaction surveys. Okay, no, for QA bala. Documentation can also be used for research. Okay, so data from your documentation can be gathered and conclusions there can be drawn. Okay, so good documentation can help to educate others on the services that physical therapy can provide. So this is also one of the ways wherein our profession actually do exist, no, in the healthcare team, no, on a medical team. Okay, in some areas of the country or in some other areas na outside of the country, PT notes, no, or physical therapy notes, those same lang siya to physicians na notes, no. For example, in Australia, okay, physiotherapist there, ang ilang notes mas ginapati siya sa mga nurses, no, as well as physicians and physiotherapists work together, okay, in improving patient, no, nga ara sa PT services. So same lang, no, sila. So amo na nga in other parts of the world, physical therapists are considered to be doctors, no, at the same time. Documentation can demonstrate compliance with federal, state, and local statutes and requirements. Okay, so we actually really take document writing very seriously, ha? Okay, so documentation is an integral part of the patient care process as the assessment or the treatment of the patient. So same lang na sila tanan in terms of the level of its importance. Documentation, same lang siya or as important siya when you assess your patient and when you treat your patient. Okay, wala isang mas lesser nga important, tanan na sila same level. Okay? So the relationship of documentation to the decision-making process. Okay? So the initial na point na when you see your patient, di ba makita mo pa lang ang patient, gasulod siya sa rehab or gasulod siya sa inyong facility, may mga different hypotheses na gasulod sa mind mo. Okay, if you are professional, ga-start na ang imong decision-making process. Pagkita mo pa lang sa patient na nagapasulod sa rehab, i-ano siya sa imo, i-refer, no, for PT treatment. Mabalaan mo na ni kung ano ang makita mo pa lang patient, mabalaan mo na kung ano ang need mo nga i-assess sa iya, anong mga types of questions nga need mo i-ask. So dira na ga-start ang imo nga clinical reasoning, dira na masulod imo nga decision making. Okay, and upon this decision making, you go back to the different elements, no, of patient-client management. Okay, and after that, after you do all of those elements, no, your examination, evaluation, diagnosis, prognosis, PT intervention, that's the time where you write, no, where you document. Okay. Okay, so as part of your clinical reasoning, and of course, no, for your decision making, we always point out, no, that the patient, no, on a biopsychosocial na model, no. So dira ta siya gina-reflect naton ang biopsychosocial model, no, on our patient. Okay, so we're in, no, disability viewed as outcome of interactions between health conditions and contextual factors. Okay, so di ba very evident diri ang inyong ICF, no. Okay, so done na kita with looking on the patient on a biomedical, no, aspect, wherein we just know kung, let's say, kung stroke, balaan ta na ko nung cure, But with biopsychosocial, we look at the patient no, as a whole person, not only curing the disease itself, but all of course, no, improving their quality of life. That's how we view our patients no, as physical therapists. Okay? Amo na nga, we don't actually really deal on medications because we wanted the patient to function as a normal na person as a normal person how he used or she used to be. Okay, when he or she comes for or asked no for our services. Okay, so guided no by the ICF model, or guided no by we will be using this framework no as how you use it man to other specialized courses that you have already encountered no. Let's say sa inyong mga pediatric, I heard na you have already applied the ICF. So same man siya no with documentation. We needed a framework, diba? We needed a guide, okay, para i-guide ang ato na thinking or thought processes on what questions ang kinahanglan naton nga i-ask sa patient. Okay? We are looking into a patient on a functional basis, no? So ginalantaw natin siya as a functional na human being, no? So if for example ang patient comes to you inability to walk, so ano ang imo da nga goal? Ano ang goal sang PT? Of course, palakton ang patient. So amo na siya ang goal, no? Functional. Okay, so amo na ang advocacy sang ICF. Okay. Okay, so if you can still remember no, the different components of the ICF. Okay. So this is an example no, of the classification according to the ICF framework. So this is just a review. Okay, so if we are using the ICF framework, if we wanted to check for activity limitations, we look at the patient at the whole person na level, diba? So kung maghambal ang patient na nga nagkadto ka di sa rehab, anong gusto mo matabo no after your PT services, mahambal ang patient na gusto ko makalakat no sang normal, okay, or gusto ko makalakat sang nami mga maamo na no, usually kung sa subjective, so we are looking no the patient on a whole person level, ara siya sa may activity limitations no or activity. And how do we measure this one? Of course, lang taon ta iyang performance. Bato palakton mo imo patient. Di ba la? For impairments naman, this is very obvious na kay it's on the body functions no, or structures. Kung, for example, may refer sa imo na may stroke. Okay? Let's say BCVA ang patient. So, anong mga different impairments dira? Of course, you would expect na ang patient may paralysis, or may paresis no on the lower extremities or in a specific muscle no dira sa lower extremity. So ari ang isa ka component sang ICF na framework. Okay? And how do you measure? Of course, you measure it through your objective no. Magamit ka dira sang different na parts of the objective, let's say review of systems, or you check for the ROM, for the MMT, no, depending kung ano ang impairment. Okay, and of course, ang health condition actually very evident na niya sa medical diagnosis. Okay, ara, no? So how do you measure that? Makita mo na siya sa medical diagnosis. So stroke is a medical diagnosis. Okay? And its PT diagnosis actually depends no kung ano ang current na problem no sa patient, functional dysfunction niya. Okay, so more examples no of its application of the framework. So under health condition, 'di ba? How do you measure this one? Usually, siya sa may medical diagnosis. Okay, so may mga infarction, fracture, yan. So, tears no, of the ACL, no, viral infection, so mga amo na siya. For the impairments naman, of course, body structures and functions, no, what do you expect kung may ara sang fracture, or may ara sang any, let's say may stroke, so may paralysis, may weakness, may sensory loss, may ROM restriction. Okay, so, amo na siya ang iyang how do you measure no that one. For activity limitations, okay, so inability to walk no, di ba, activity limitations focuses on the whole person. Okay, kung ano ang mga abilities or inabilities niya to function, okay, as a whole person. Okay na basically ang aring imong activity limitations it would deal on the basic ABLs, mga your adept bala na your ambulation, dressing, ng mga personal hygiene, na their transfers. Okay. For participation restriction naman niya, usually diri na di ang mga social roles niya. No, for example, inability to take care his or her own child, no, or inability to I don't need to work, no, inability to care for oneself, no. So there. Okay, so using this framework, you will know no kung ano yung mga thought processes in dealing with the patient, no, in terms of in terms of subjective assessment. You will know kung ano mga different questions ang i-ask mo. Okay, and then from your subjective, you will also know kung ano ang need mong i-assess sa iyo objective. So kumbaga hindi siya tama ka vague, no, kung may ara ka sang framework, okay? Kung may ara ka guide sa imo, hindi siya tama ka vague ang imo nga documentation, but gina-focus mo lang gid kung ano ang relevant, no, para sa patient na case. Okay, hopefully I'm making sense here, ha. Okay, so again, as a review, ICF components, no, body function and structures, no, so you talk about functions and structures there. Activities and participation, of course, ang capacity sa patient and ang iyang performance. Okay, so basically dire mortgage siya on mapakita nyo gid ni or ma-measure nyo gid sa iya na objective, no, sa objective na part, no, of the note. Okay, and of course environmental factors, no, pwede nyo ni actually makuha during the subjective part or even sa objective man na pag-assess, no. So what do you think mga different barriers kag facilitators? Let's say your patient lives alone, di ba la? So that could serve as a barrier, no, for the patient. One sa iya na environmental factors. Okay, so why do we need a guide, no? As I said earlier, since it can help us aside, no, from the thought processes nga pwede niya ma-help sa aton, it provides a framework for our own practice. And it provides a common language, no, and framework for clinical instruction. It implements a common approach to measuring outcomes for documenting effectiveness, no. So I don't know kung na-realize nyo na siya during using the ICF, no, from subjective, let's say in documentation, in the context of documentation, subjective, objective, assessment, assess a plan, dapat naga-correlate sila tanan, no. It's not that na you write something in the objective na wala mo man siya gali ginbutang, wala mo man siya gali na-assess properly, no, and then naghatag ka lang sa intervention on that particular, no, na part of the objective which is not relevant siya sa patient. So dapat naga-correlate sila tanan. Okay, so if you have determined na ang patient mo may muscle weakness, no, on, let's say on the lower extremities, you assess it through your MMT, and then after assessing it through the MMT, you give an intervention for that. Okay, doon mo na siya ang purpose ng imo na ICF. Okay, so there is a common approach to measuring outcomes, no, for documenting effectiveness. It develops research hypotheses and, of course, it educates the external community and peers. Okay, so again, no, here are different elements of patient-client management. So actually, this is some sort of a review, no, for everyone. No, okay, I always believe that repetition is actually would helps. No, it really helps. No, if you wanted to master a certain na aspect of our practice. So examination. So this is where you actually gather your information, no, from the chart. Okay, so pwede ka most especially sa patient demographics. Usually, dira na lang gid kita ga-base sa chart. But of course, for documentation purposes, we also ask no other things nga ara sa aton nga demographic information. Okay, from the chart, from other caregivers, the patient's family, and the caretakers and friends. So during the initial session with the patient, the process of assessment and decision-making occurs in the following manner. So the therapist first would read the patient's chart. So malantaw kita dani sa medical record, we look into the medical diagnosis. Okay? So that's the initial step of our documentation. So we gather the data that would include patient's demographics and the diagnosis. Okay, so, and then after that, after looking into the chart, the therapist then interviews the patient. So the data gathered here under the subjective of the SOAP format. So diri ka na ma-start collecting your data for the subjective na part. Also, as part of the examination, from the information gathered from the medical record and the patient, the therapist plans already the objective measurement to be performed. So it's really better to have an assessment plan. So mabutang kagidanis ang imo nga assessment na plan, okay, or objective measurements na plano kano ang i-assess mo. Kaya during subjective, you can actually already know kano ang dapat mo nga i-assess for the objective. Then the planned measurements are being done in the objective section of the SOAP format. So what I actually do when I interview the patient for my subjective documentation, sa shift complaint pa lang, I can already know kung ano ang need ko nga i-measure. Okay? Maghambal pa lang ang patient na hindi ako kalakat